Hi, this is Harold, recording my part of the presentation. Hopefully you'll be able to use this, and it'll fit in with what Chris and Samantha are talking about. I actually interviewed a therapist from the Preferred Family Clinic. Her name's Laura Morris, and talked to her about the treatment plans that they use and the format that they go through in trying to create those treatment plans. And there are just some basic steps, and I'm not sure if they're going to be able to show you the PowerPoint at the same time that I'm talking about this, but if not, hopefully they can play this and then you can see the PowerPoint afterward. But the treatment plan format that they use, there's an initial intake that is done with the client once they come in. In that initial intake, they're able to kind of get an idea of what the client is going through and hopefully an idea of what they're going to be able to do in order to help the client with the issues and problems that they're having. After that initial intake is done, the therapist will a lot of times do an assessment of the client as far as how long they've been experiencing the problems that they have, and then also getting a history of the client as well to go back as far as they can to try and help the client or try and understand why the client is maybe experiencing some of the things that they are experiencing. And then after that is done, a diagnosis is made and then a treatment plan is formulated for the client. Treatment plan development, as I said, the therapist and the client discuss the symptoms that they're experiencing and then the diagnosis, not necessarily where they come out and say, this is your diagnosis, you have depression, but they'll actually discuss a lot of the areas that the client is finding problems in and then try to work on those. The therapist, Laura, said that a lot of times what they'll do is they'll actually talk about the symptoms and then kind of bring in the fact, if they're experiencing depression, hey, you know, these are similar symptoms to what a depressed person might feel. And then trying to help the client buy into the diagnosis that they've received. Once they do that, then what the therapist will try to do is set goals with the client on what they want to be able to accomplish. And then after that, the therapist will create a treatment plan using the goals that the client wants to be able to achieve, and then using different therapy techniques to actually help the client improve. So the scope of the treatment plan, the therapist's goal with the treatment plan is to help the client help him or herself to overcome his or her problems. And so the therapist is a guide basically to help the client in overcoming the issues that they're experiencing. Laura told me that sometimes what she'll do with clients to try and help them buy into the diagnosis that they've received is she will actually give them a test. For instance, the Beck's Inventory Depression Scale or the Anxiety Scale, and she'll actually have the clients take those tests in order to help them buy into the diagnosis that they're receiving. Whereas when they take those tests or fill out those surveys, they're able to actually see, oh, you know, I've got several of the criteria that fit a depressed person, or I have a lot of the criteria that fits someone who's anxious. Or, for instance, with suicide, I've got the symptoms of someone who is experiencing suicidal feelings. And she said that a lot of times she'll do the testing to actually help them to buy into the diagnosis that they're given so that they can actually see what they're experiencing themselves. And then the treatment plan is actually a guide for the therapist. Laura said that she'll use that a lot of times to keep on track so that she's not going off into different areas that are not necessarily going to help the client with the therapy that they're receiving. And she said a lot of the treatment options that she uses are just standard. So CBT, REBT, DBT, she'll use Gestalt therapy, sometimes a humanistic therapy, talking to the client, trying to find out what they're experiencing and help them discover for themselves what is going on in their lives. The pros for this, she said, is that it's very simple and accurate because a depressed person usually has signs of depression. They're able to look at that and say, yeah, this is depression. This is anxiety. able to really do that quickly and simply without going into a lot of detail. She said it's less expensive and less time consuming, the process that they do. Some of the cons that she said this type of therapy process or treatment plan process has is that sometimes it's not thorough enough, maybe not delving into a person's life enough to help understand exactly what the client is going through. It doesn't always, the therapy that she does, because it doesn't take as much time and isn't as costly, obviously because they're not spending as much time in therapy, it sometimes doesn't allow the client to actually buy into the diagnosis that they've received. So even though she tries to use some of the testing to help them do that, sometimes they're not able to do that because the therapy and treatment goes by so quickly. And then she said, as I said earlier, it doesn't always allow the therapist to go into some of those areas that the client is maybe having more problems in. Doesn't allow them to do that because they don't have the time or resources in order to do that. So hopefully that'll give you an idea of the Preferred Family Clinic and what they're going through.